Welcome to the second video in a series we're calling COVID-19, Patients, Families, and Providers in Conversation. This second video is focused on understanding what COVID-19 patients are going through, how we can do a better job of helping them heal, and improving the overall system of care based on these learnings. I will be the moderator for this session. My name is Rachel Weisberg. I am a quality improvement and change management consultant. I've been working with hospitals for the last 15 years, specifically in the areas of patient and family engagement, care coordination, and social determinants of health. I am also a patient with 3 chronic health conditions. Although I wish it were under different circumstances, I'm so pleased that I'm able to introduce my brother, Josh Weisberg. Josh has built software companies and worked in public policy, but more recently he's been writing and getting in touch with his creative side. We've connected as he has channeled his experience as a COVID patient over the past 6 weeks into that desire to connect with others in their experience during this pandemic. Josh, I thought we could just start out by you telling us just a little bit about your overall experience these last 6.5 weeks.
I would say the biggest overarching impression of being sick with COVID has been just the uncertainty of it. So if you think of, you got mild patients, you have moderate patients, so moderate symptoms, and then you have severe cases that are spending a lot of time in the hospital. I would say in the moderate bucket. So most of the last 6 weeks has been from home. I've been going through this experience, and it is just a deeply uncertain experience. So I had some of the common symptoms, so a cough, I've had aches and pains, I've had a lot of weight, a feeling of weight on my chest, which has come and gone, but when it's really bad, it feels like somebody's just gripping my chest, and it's really hard to get a breath in, and that causes a lot of anxiety and a lot of fear, and then when it gets at the worst end of that, it's felt like shortness of breath. And those are the times when I've wondered what to do. Being at home, I live by myself, and I've wondered, okay, what's the next step? What sort of care is available? What are my options? And on day 6 or 7 was the time that I really felt like I was presented with a hard choice of, should I go to the hospital? Should I go to the ER? Should I try to wait it out? And there are a lot of things about that choice that are hard as a patient. But for me, one of them was that I just didn't know how dangerous it was to go to the hospital. Another one was I didn't know what treatments were available. I knew that eventually maybe there was a ventilator if there was capacity for that. Maybe there was oxygen, but I didn't know how close I was to actually needing those things. And I didn't want to be a burden to the system in going if I didn't need to go. So I think that was one of my first, as the symptoms got worse at home, that was one of my first experiences, is just not knowing how to make the call about going in and seeking help. And also not knowing how to interact with my doctor in a normal way, because the doctor's office didn't want COVID patients, understandably, coming in. So I did go to the ER eventually, and they did give me some guidance around, look for shortness of breath, look for some of these symptoms that show that your blood oxygen level is dropping. But it's been 6 weeks, for the next 5 weeks after that, it's been a wild ride where the symptoms come on strongly and then they'll almost subside completely for a while, and they'll come on again. And so there's a lot of uncertainty in navigating the choices that I make and what the next day is going to feel like for me. And it's a scary thing. And I'm just having to, I think, like a lot of people, come to grips with that up and down ride.
I want to talk a little bit about the issue of testing, since this has been such a big part of this conversation throughout the country. Testing, the reliability of it, the access to it, both diagnostic and antibody, varies a lot. So I was wondering if you could just talk a little bit about your experience with testing.
I would say that it wasn't available, and it was also difficult to understand how to request a diagnostic test to know if I had COVID, which my understanding is you need to do that in the early days. And my doctor's office never had a wait list, which surprised me, to say, oh, we don't have these available. But this is how we're progressing through the cases that we see. We're going to put you on a wait list. You'll get a call when they're available, or we'll update you in some way about how this works. It was kind of a hands in the air. We're not sure. There are no tests available, which was surprising for me. So that was the diagnostic side. And then on the antibody side, I have gotten a prescription to take an antibody test, but I need to do that at a special hospital that allows COVID patients to go into that particular lab. And my symptoms have come and gone continuously over the past several weeks, and I haven't made the effort, partly because we don't know exactly what antibody testing, what information that gives me that's actionable. But I haven't made the effort, partly because of symptoms, partly because of confusion around what it means if I had antibodies in terms of how my life would change. And I'm not sure that it would right now. So I do have a prescription for antibody testing. It does seem more widely available than diagnostic testing, but it's still been a bit of an adventure to actually get one done, since I have to go to the special facility to do it.
That's so interesting. Thank you for that information. And you raised some really interesting issues. I think that one of the things that has been apparent throughout all of this is just because our healthcare system tends to be very fragmented, and there often isn't as much coordination between providers as there should be. Something like this that requires additional coordination becomes even more difficult to treat. And I was hoping, Josh, that you could sort of look at these last 6.5 weeks, and you've already touched on a number of ways in which your care could have been better and maybe give some specific examples of times when your providers could have given you information that was more clear, and ways in which you think that coordination could have been stronger. And I think that the reason I'm asking that is because, we're trying so hard to find the best ways to treat COVID patients, but also looking to improve the overall system of care.
Yeah, so in terms of improvements for my follow-up and my treatment, I'm aware of the fact that everybody's been blindsided by this. So it's not like we could have gotten it right out of the gate as a medical system, but I do feel that some things have been pretty confusing and have fallen between the cracks for me. But there were some other things like, should I get an x-ray? And the answer to that has changed over time. I'm not sure why, so I'll talk to different providers. My primary care doctor, who sometimes would see me on a telehealth visit, but then sometimes it would be a respiratory clinic, which was set up specifically at my doctor's office, my primary care facility, but for patients who presumably or positively do have COVID. And they were doing that to separate the patient populations out to make sure that people stayed safe. But the communication between those wasn't always great. And one of the examples of that was, at first I was told when I went to the ER that I wouldn't do a chest x-ray, or I wouldn't get a chest x-ray because it wouldn't change my course of care. Then when I talked to my primary care doctor, he said I should get one. Perhaps I have pneumonia or could develop pneumonia, and he wanted to be aware of that. And then later on, I ended up getting another chest x-ray because I've had some relapses 5 or 6 weeks in that have been pretty scary, pretty difficult relapses. And so we wanted to see, has the look of what's going on inside my lungs, has that changed over time? And so I've gotten different responses to that over time. So x-rays, I think, are one example. And another one that I'm really surprised by is, as I mentioned earlier, really difficult to know when to go in. So if you're in this moderate category, and most of the time you feel something's wrong with your breathing, but it's not so bad that you can't get a breath in, and you're trying to just get through it at home and not expose yourself, not be a burden to the system, there's this really hard line of when to go in and seek care. Am I short of breath? That's a question that I'm sure many COVID patients are asking themselves at home. And a huge tool that I think can help answer that question is a pulse oximeter. Most of us don't have pulse oximeters, and they're very difficult to find. And I'm surprised they're not expensive. I did a little bit of research and finally got one in week 6. And that has helped to decrease the amount of uncertainty and confusion I'm feeling around, should I go into the emergency room and request oxygen? Because what is my blood oxygen level? And before that, it's very subjective, and it's very hard to know what your body's experiencing because you have a lot of uncertainty and fear, and and it's changing over time. 10 minutes might feel one way, then the next 10 minutes your chest is a little less tight and the breaths are coming in. You get up to go to the bathroom, your heart races, your breathing gets shallower, and it's hard to know, well, am I close to the line here? So I think distributing and making available pulse oximeters to patients would be a really good way to help decrease that uncertainty and help doctors follow up over time.
That's a really, really good point. There's nothing scarier for patients than simply not knowing when to get treated or just being in those sort of unknown categories. How you are doing with all of this, just the whole mental health and, all of the emotional aspects of being a patient, and especially because you live alone, Josh, and even though I know you have a really strong community there in Boulder, because you've had to isolate, essentially been dealing with this by yourself. And just wanted to ask you, how has that been? And, on a day-to-day basis, how are you managing all of that?
It's hard to go through alone. And I know from others, our sister who has a family, that, there are different ends of the spectrum. So it's hard to be in quarantine with lots of people. And it's also hard to be in quarantine alone. So that's been my experience is mostly going through this alone. I've had friends come and bring me groceries, and I've had lots of delivery people help out in bringing things to me, and that's been great to have that support. I feel like I'm not totally alone in it. One of the biggest things that I wanted when I was going through, particularly in the early days, that window of about 2 weeks, 2.5 weeks maybe, you wonder, are the symptoms going to turn really, really bad? Am I going to go into that severe patient bucket, or am I going to stay mild or moderate? And you don't know, because there's so much uncertainty. The symptoms come and go, and there are all these stories, even for young people. So you're in the middle of navigating that daily difficult experience. And what I really wanted was to connect with other COVID patients. And I didn't actually know anyone directly who had the virus. And a friend of a friend put me in contact with someone who was about a week ahead of me in terms of his symptoms unfolding. And that was very helpful. So that's one thing that I would say is, even with friends and family, hopefully checking in as they were as you did, and as many of my other friends and family did, it really helps to have somebody else who's also going through the same experience. I would say connecting with other patients is a huge resource. And then also feeling like there's support around me from friends and family, and logistically from my medical team, has been really, really good and really important.
We're coming to the end of our conversation, and I just wanted to ask sort of, what are your hopes and fears going forward now?
My hopes and fears going forward from this are that my convalescence comes to a close. I've heard it could take, from Italian patients who got the virus early, 60 days is not unusual for a moderate case, and that seems long, but I'm only on day, 46 now, and I had a pretty bad one 2 days ago. The fears is the recurrence and the wondering, am I relapsing? Did I get the virus again? You wonder all these things because we don't have much length of experience. So there's a lot of uncertainty, as I said, and my hopes are that through this experience, I can become more resilient in the face of uncertainty, and in my own life, just learn to take that in. We have to do that in terms of quarantine, in terms of how society works. I have to do that as a patient. And then I really do hope that our medical system learns a lot of lessons around infrastructure and around following up with patients in a really compassionate way. And that makes such a huge difference in my experience when I feel taken care of and checked in on, and that I know the next steps. I just know what the doctor's thinking. I know how they're trying, even if they're doing it imperfectly, how they're trying to help. And so I hope that as we move toward hopefully a more personal way of caring for patients throughout this whole crisis, putting the pieces together across providers and having better follow-up, that could also make its way into life going forward, even after the pandemic.
Josh, thank you so much for sharing all of this with us and just being so vulnerable. I think a lot of people are really going to appreciate hearing from you. I just have two last questions. One is, if there are COVID patients listening to this and they want to connect with you, how would you like them to do that? And the second part of the question is, what would you like people to know about COVID, if there's just sort of one last takeaway?
For your first question around connecting with other COVID patients, I would love to. It is deeply satisfying for this whole experience to mean something in supporting other patients. And so that's why I'm on the call. And that's been one of the great satisfactions of this, is that I've written about my experience, and I've felt very strongly that, in going through a hard thing, it brings people together. And so I would love to be put together and to support other people who are also going through it. The best way to get in contact with me is to go to my blog and to leave a comment. So I have a post there about COVID cohorts, which are just groups of COVID patients who want to get together and talk about their symptoms and get support. So you can go there and you can leave a comment for me, and my blog is just my name, Joshua Weisberg at joshuaweisberg.com. So that's a good way to get in touch. The second question was, got to take it one day at a time. That really is, if you try to get ahead of yourself, if I try to get ahead of myself in predicting or counting on being recovered or getting back to normal, some semblance of normal, it's been really frustrating to do that. But I think to really appreciate the gift of the day, of whatever recovery's been made, whatever breaths are coming in, is a real gift. And so whatever the version of that looks like for each person who's going through this in their own way, whether they have the virus or not, I think that's the thing that stuck with me.
I think that can be a really beautiful takeaway, to learning how to live in the present in spite of the pain. Thank you again, Josh. This has just been really meaningful. To everyone listening, thank you for joining us. Stay safe and be well.